What brought you to HCEG? I understand this is your first time.
It is my first time, and I was really excited about a small conference where there could be more conversation and less just presentation.
Okay.
And so I had heard about this group and thought it was time to check it out, and as I told Ferris, find my people.
Okay, and how has it been? Have you been finding the right people?
I have. It has been wonderful. I am new to the payer side of healthcare. I've been working at HealthCare about a year, and so actually finding those people that I called my people has been interesting, and being able to have those conversations one-on-one with the other attendees and the speakers has been wonderful.
That's terrific. Looking at some of the sessions that you'll be attending and also the ones that you've already taken part in, what holds special relevance to what you're doing at your company?
Yeah, another good question. It's there are so many topics that are relevant to me. I'm most interested in learning more about what other health plans are doing around transparency and the digital business, how they're supporting their customers, where they're providing personalized experiences. I heard of a great one this morning where they're doing cost sharing with their member, where the member can call in and say, hey, I'm interested in, are there other alternatives for imaging that are lower cost? And then sharing that savings with the member. I think that's a great idea to get members to buy into it and let them have a portion of the savings that are resulted in that. So I think those interactions with other payers to understand what they're doing, as well as with the providers of what they're interested in, are of most value to me.
Sarah, this is your first time attending HCEG. What are your impressions so far?
So far, it's been great. It's been an excellent opportunity for networking, really meeting with other executives from healthcare organizations who not only are not bored by what I do, which is a nice change of pace, but who really understand the challenges that we face in our industry and have insights on ways that they've tackled them, successes and lessons learned. So it's been very valuable.
Were there particular questions you had in mind before arriving at the summit that you hope you could discuss with members?
You know, I'm always interested in the technological advances, how people are using both from a telehealth standpoint, but also the data science. That's really where my passion is. So it was really interesting to go over to IBM Watson yesterday and tour their facility and get a sense of how IBM is utilizing augmented intelligence in healthcare and what we can sort of glean from their experiments as well.
How have you seen this event change and really the mission of the organization?
Well, first of all, there's a lot of conferences in healthcare. There's emerging conferences, there's historical conferences. This one has been sustaining for basically 30 years. The mission has changed a little bit. It was an original organization based on CIOs and CTOs who were sharing information and experiences. Now it's more of a diverse agenda where you have different topics and trends being discussed versus oriented around technology executives. Okay. And I also think the audience has changed and it's become broader too. You have payers, providers, investors, companies, payers, so it's become more of a diverse organization.
Some of the members here are obviously going to be very interested in what you're talking about on the innovation side. Have you found conversations that will be of value to you when you go back to Anthem?
We are always interested in meeting with entrepreneurs, new entrants, startups, and our partners in healthcare, because what we have found out is that the best ideas, the best answers to the toughest questions don't always reside in the four walls of our own organization. And so for us, it's been really interesting to find how people are thinking about the same challenges of delivering the right care to the right members. How do we take care of members in their community, members who don't speak English, members who can't afford to go and have the copay to go visit a physician. So for us, it's been really insightful to see how other organizations are answering some of these challenges that we have as well.
Thank you for having me.
Yes, I understand this is your first visit to the summit.
It is. It is. It's been great so far.
And what sort of information have you been sharing with members here today?
Yeah, I was on a panel leading a conversation around health equity and social determinants of health in conjunction with Dr. Erica Pabo from Humana and Rob Garnett from Amerigroup in Tennessee, which is an Anthem company.
Okay.
And we are working with both of them. So we were talking about their experiences working with Lyft, both within a Medicaid population and in a Medicare Advantage population.
Is this a meeting you think would be of value to go to annually?
I think so. It's a really strong, I like the intimate setting. I like that it's a little bit smaller, more focused. And I think that there's a lot of really good speakers. And the topics are always timely. And for me, being a local person here, reconnected with a lot of people that I haven't seen in a long time in the market. And sometimes it takes a conference like this to get, those connections reestablished.
Right.
So it was good.
Okay, great. Well, thank you so much for your time. Really appreciate your
Great.
comments.
Thank you.
Thank you. Okay, Ricardo, and what are your impressions of the summit so far? I know we're just getting into you had a lot of fun at the game yesterday.
It was a lot of fun at the game.
Yeah.
Although the Red Sox lost, I'm an Orioles fan.
Oh, okay.
So the Red Sox losing wasn't really an issue. The Yankees winning is a bigger issue. So far, I mean, the conference is a great conference for the level of executives and people that you have in the room talking about issues. There's not a lot of primers at this conference, which is nice. You've got people who are ready to dig deep on issues and can have executive level conversations pretty quickly and identifying, I think 3 or 4 yesterday, potential partnerships between our organizations and how we can work to solve some of these issues together. So first time, but won't be the last.
All right, Ricardo, thank you so much.
Thank you. This was easy.
Thank you. All right.
Yeah.
Thanks. And do you feel that the content or the information coming out of the meeting has become even more invaluable to the people that come to the event?
I think so. I think the information people walk away from is the type of stuff they probably don't get back at their day job. For example, there's companies here that are within our portfolio, such as reflecting the opioid crisis. They're going to hear firsthand on how companies are dealing with technology and true patient experiences. There's a mergers and acquisition panel where we have strategic investors, financial investors, and an investment banker. Those type of discussions are important to bring back where they could share, I think, with their constituents.
Mm-hmm. Do you find that it's as exclusive a group as it started out to be?
I think the word is it's still intimate by design.